Thank you for joining our New York Advocacy webinar today on the Rare Disease Advisory Council bill in New York. We're excited to be talking today about the bill, different ways to get involved, and our upcoming Advocacy Day on April 30th. I'm Rose Avellino, our Grassroots Advocacy Manager, and I'm with...
Hi, I'm Tim Boyd, Director of State Policy for NORD.
Great. Well, we're going to mute all lines during presenting today, but we will take questions at the end. In addition, this call is being recorded so that we can share it with the network after for those who are unable to join us today. So NORD, just for some quick background to start off, NORD, the National Organization for Rare Disorders, is an independent nonprofit that is leading the fight to improve the lives of rare disease patients and families. We do this in 4 different ways. We have departments focusing on policy and advocacy, doing like the webinar that we're on today, research, education, and patient assistance. We do this alongside our 280 plus disease-specific organization members to help with the identification, treatment, and cure of rare disorders. And now I'd like to introduce our New York State Rare Action Network Ambassador, Mary Wooten.
Hi, can you hear me?
Yeah, we can hear you.
Okay, great. Hi, I'm really excited to be your New York State Ambassador. This is Mary, and I really look forward to seeing you all on April 30th on our Advocacy Day. And until then, you can stay in touch through email and Facebook, Twitter, and our Rare New York webpage. Thanks.
Thanks, Mary. So now getting started, we wanted to provide an overview of the New York Rare Disease Advisory Council. So Rare Disease Advisory Councils help tackle the problem of the lack of awareness for the over 7,000 known rare diseases. As many of you know, there's new rare diseases being diagnosed all the time, and so it's difficult for anyone, let alone our busy state policymakers, to have an in-depth understanding of our community. And this leads to many common difficulties for patients and their loved ones, such as delays in diagnosis and difficulties accessing treatment. So the New York Rare Disease Advisory Council will help tackle government barriers by giving the community, you all, a formal voice in government. This will help give patients, families, caregivers, and medical professionals all an opportunity to make formal recommendations to your state elected officials and other leaders about the pressing problems in our community. So the New York Rare Disease Advisory Council will be made up of 21 members with different appointments from the governor, the Speaker of the Assembly, and the President of the Senate. Some of these, the membership includes physicians, nurses, hospital administrators, patients, caregivers, patient organization leaders in New York, pharmacists, industry, health insurance companies, members of the scientific community, and genetic counselors. So it's all really a diverse makeup of the community to help make sure that all of our voices are being heard. At the end, the council focuses on achieving 5 priorities. These first include studying the economic burden and treatment of rare diseases. Second, developing recommendations pertaining to the impact of healthcare coverage and the provision of treatment and care services. In addition, the council will help identify best practices for rare diseases that could help improve the treatment for other patients in the state. Fourth, it will develop a list of existing publicly accessible resources to help the community. And lastly, the council is tasked with preparing and writing a written report to prepare for the governor and the Speaker of the Assembly and President of the Senate. So now I'm going to turn it over to my colleague Tim to give a background on rare disease advisory councils in other states.
Hi, everyone. So although we're very excited about the idea of creating an advisory council in New York, this will not be the first state to have such a model. There are actually several states that have already enacted an advisory council or something similar to an advisory council in their own state. So you see the list here if you're on the webinar, where Alabama has one, Illinois has one, North Carolina has one, Connecticut has what's called a Rare Disease Task Force. Kentucky just enacted a council that was signed by the governor a few weeks ago, and Pennsylvania has one. That all of these states have something that kind of looks similar to what we're proposing in New York. And in addition to all those councils that have enacted, all those states that have enacted such a council, we're also working in all these states to do similar work this session. So New York, as what we're talking about today, obviously has a House and Senate bill, but these other states are also considering implementing a council as well. So although we're going to talk about advocacy that we're trying to accomplish in New York on the 30th, if you have friends or family or colleagues or even organizational colleagues in other states that are interested in this as well, there may be opportunity to do advocacy in those states as well. So I want to actually pause here for a second before we get into talking about exactly what's going to happen on our advocacy day on the 30th and answer any questions folks may have about the council itself and kind of what is being proposed in New York. And if you weren't tracking it before, I just want to make sure I highlight the fact that the bill in New York is Assembly Bill 5762 and Senate Bill 4497. And if you don't happen to remember that, we will be sharing a recording of this presentation and these slides with all of you and everyone who registered so that you'll have the information provided by Nora. But I did want to stop for a second to answer any questions about the council itself that you guys may have.
In addition, if you're just joining us via the web today, feel free to use the chat function as well to type your questions in.
All right, well, I think I hear one person talking, but if you're trying to get a question and you're not being heard, try to chat it in the box or dial in using the phone information. Otherwise, if there are no questions at this time, we're going to move on to talk a little bit about our Advocacy Day plan for the 30th. So what we will be doing on the 30th is going up to the Capitol in Albany and meeting with legislators in their offices to encourage them to pass this bill. Right now, the Assembly bill is in the committee, has passed the Health Committee already, is in the Committee on Ways and Means, and on the Senate side has been referred to the Senate Health Committee. And we'll talk a minute about things you could do in addition to attending the Advocacy Day to get involved with the council. But Rose, do you have information we can provide to folks about the actual logistics of the day of?
Yeah, so we're working on confirming the logistics for the day of, but for right now, we're asking that folks try to arrive by 9:30 a.m. We'll have to go through security, and then we'll be sending out a meeting room. We're working on locking that down, where we'll meet and divide into groups, and we'll give a brief overview again of what the bill is, answer any remaining questions, and also give out folders or handouts that you can take around to the meetings with you. So again, I would recommend just arriving by 9:30 to get through security. Stay tuned for a room where we'll be meeting at first and to divide into groups and do some meetings around the Capitol.
And we're still working with the legislative sponsor to secure exactly that designated meeting room, but we will send that information out to all of you as soon as we have it. In addition, if you are able to join us on the 30th up at the Capitol, we'll provide a day of contact phone number that you can use once you're heading up to figure out where to meet with someone and the like. And your role there on the day of for us is really just to talk about, from your perspective as a patient, as a caregiver, as someone who's just a supporter of the rare disease community, why you think the creation of a Rare Disease Advisory Council is important for New York. And we'll cover a little bit of that the morning of, once we divide up into groups and plan out the meetings for the day. In addition, if you've already registered for it, or if you plan to register for the meeting, we will set up and request meetings with your specific state legislators in New York. So not only do you have a chance to talk to just other legislators about the importance of creating this advisory council, but we're hoping to set up meetings with your specific legislators if you register in time. Are there any questions so far on the kind of specific logistics for the day of, or how to register and get involved for attending the Advocacy Day on April 30th?
Tim, I have a question. If you are a new advocate and you've never, been to the Capitol before and talked to your legislator, is this an okay, event to attend?
Yes, this is open to all kinds of advocates, first-time advocates, experienced advocates. As we said, kind of as indicated before, all you really need to come prepared to do is talk about why support for the rare disease community is important for you and your own personal experience with rare diseases. I think part of our purpose in trying to create this council is that it helps address barriers that everyone in the community is facing. So the very fact that you are a member of this community and that you can speak to the challenge that you or a loved one may have faced in dealing with the rare disease makes you a perfect fit for this Advocacy Day. It makes us really want you there to help share your experience. And I know some of you may be nervous about doing that if you've never done it before. It's also fine for you if you just want to attend and see what happens and listen into what others are saying. That's also fine too. Hopefully by the end of the day, after a few meetings, if you just sit and listen, that you'll be willing to speak up and introduce yourself. But if this is your first time trying to do something like this, we're welcome for you to join, even if you're not comfortable speaking yet. And I also want to note, going back to, so if you aren't able to join us on the 30th, there will be an opportunity to also take action online. So Mary mentioned when she introduced herself that we have a website, rareny.org, that has information about the council and other things going on in New York. We're going to post an action alert on that page and on our rareaction.org page that will allow you electronically to send an email directly to your legislators, encouraging them to support the creation of a New York Rare Disease Advisory Council. So we hope you join us in person, but if you're not able to on the 30th, there'll be another opportunity for you to take action as well. And for those of you that will be joining us in person, you can kind of double your impact by, once we create that action alert, by sending an electronic message too. So that's really all we had for today. I'm happy to stay on for a few minutes. Rose and I are to answer any questions you may have about the Advocacy Day coming up. In addition, you see the contacts here on the screen if you're on the webinar about folks you can reach out to if you have further questions about this. Again, we'll be sharing a recording of this presentation and the slides to everyone who registered. And if you know someone who may be interested in this who didn't register, please feel free to share that with them as well. And we'll also be sending up a follow-up email with more specific logistics about the Advocacy Day, who you need to contact if you're interested in attending, what the day will be like, how many meetings there may be. We will, if you are coming out for the Advocacy Day, we will provide lunch as well and make sure you're fed and hydrated and all that. But it's a fun experience if you haven't done it before. It's a great way to share your own rare disease story with legislators and help in support of this legislation. So with that, we're going to keep the line open for a few minutes if anyone has any questions, but thank you for joining us today, and we hope to see you on April 30th at the Capitol.
Hello, Tim. Are you there?
Yep. Hi. Can you hear me?
Hi. This is Rich from the Transient Global Amnesia.
Hi there.
What arrangements are you going to have? I haven't been up to Albany in several years for parking.
That's a good question, Rose. Do you know what the parking situation is right there?
Well, there is some limited parking available on the streets. In addition, there are a couple lots. We can make sure in the email that will be going out before the meeting, that we include some addresses for parking.
Yes.
But it is pay to park.
And if there is pay to park, NORD will either cover that on the spot for you if we're able to coordinate with you ahead of time, or reimburse you for any of those parking costs.
That sounds good. Thanks.
No problem.
Hi, this is
Nobody
Mary.
else
Would it,
Go ahead.
Go ahead, Mary.
hi, thanks. Would it be appropriate for us to bring our rare children along for that day?
Yes, please do. Children, family members, colleagues, friends, frenemies, anyone who you think is supportive of the rare disease community, we'd love to have them there, even if they're just interested in learning more about how this works and they may not be ready themselves to speak. Great question, Mary. All right, well, we'll stay on for another minute or so, but thanks everyone for joining us today.
Hello, Tim again.
Hey there.
Yeah, it's Rich again from Transient Global. Did you get that packet I sent electronically?
I will double check on that. I have a lot of emails I haven't gone through yet, but I will double check. And if you register for this, I have your card as well, I think. But I will, if I don't find it, I'll circle back with you.
Yeah, no problem. I just had trouble getting your email, and then Debbie finally got it to me. So I wasn't sure if you had gotten. And you're right, we all had a lot of emails to do after coming out of the conference.
Yeah. But I'll double check one. If I don't have it, I'll send you a note.
Okay, see you the 30th then.
Great, thank you. Look forward to it. All right, well, hearing no other questions, folks, thanks so much. You see our contact info there. If you have any questions, reach out to us, and appreciate your time today. Thank you.
Thanks, everybody. We look forward to seeing you on the 30th.